Hello, it is Wednesday, and this week we are going to talk about a question we get asked all the time. When is the best time to have the next baby?
Yeah. And with that, what does the medical literature say about it? Also, how was our experience with 2 under 2? And is there any chance we're even ever going to consider baby number 3?
Yes, so we are going to go into all of that this week. If this is your first time meeting us, I'm Sarah. I am a board-certified OBGYN and fertility expert, as well as mom to 2 toddlers.
Yeah, I'm Kurt. I'm a board-certified pediatrician. And we are the Doctors Bjorkman. Welcome back. We have been sharing all about the pregnancy, birth, and parenting journey along the way as we have experienced it ourselves. And today we're talking about that hot topic about when is the best time to get pregnant again after a previous pregnancy.
Of course, this is a very personal decision, and a lot goes into thinking about what is best for you and your family, determining when you are physically, emotionally, mentally, and financially ready for another pregnancy. Having said that, though, there is some data about the medical side of this that we can share with you so you have all the information for your decision making.
Yeah. Now, the Sparks Notes version here is that if you live in a developed country and your prior pregnancy ended with a vaginal birth, there's not a whole lot of difference of risk to mom or baby if you conceive anywhere between 6 months and 5 years after that prior pregnancy.
However, there are some very important reasons that your OB may recommend you try to wait to conceive until at least 18 months after a prior delivery, and that's what we're going to go into today. Kind of some of that's at the end, so stay tuned.
Yeah, and for fun, we are going to share our own in real life experience with having 2 under 2 now that our youngest is now walking, talking, and potty trained. Before any of that, you may wonder, how soon is it even possible to get pregnant again?
So if you are not breastfeeding, most women start ovulating again 6 to 12 weeks after the baby is born. And so more quickly you could get pregnant if you are not breastfeeding. For exclusive breastfeeding, there is a form of contraception called lactational amenorrhea. And what that means is you are directly breastfeeding baby every 4 hours or more frequently, baby to boob, and that often suppresses ovulation pretty effectively for up to 6 months of postpartum.
Gotcha. Now, there is this crazy phenomenon called superfetation, which is actually where a woman releases an additional egg while already pregnant, causing her to have 2 developing pregnancies in the uterus at the same time that may have even potentially been conceived weeks apart from each other.
Superfetation is an exceedingly rare phenomenon and of course is not the norm. However, it's a good point to make that if you are having sex and are not contracepting, pregnancy is possible almost any time.
A good place to start this conversation today about pregnancy timing is to discuss what different risks have been seen with short interval pregnancies. You may have heard that you should wait a year or 18 months between getting pregnant again, but where does this recommendation come from and why?
So currently, the World Health Organization recommends waiting 18 to 24 months between birth and getting pregnant again. And this is to reduce the risk of stillbirth, low birth weight babies, and preterm birth.
Yeah. Now, there have been numerous studies looking at the risks associated with interpregnancy intervals over the past few decades. And overall, extreme birth spacing, that's being less than 6 months between birth and pregnancy or greater than 5 years between pregnancy, has repeatedly been found to carry extensive adverse effects to the health of both mom and baby. Now, just in this past year, a recent meta-analysis that averaged the data from over 46 million pregnancies from 129 different studies summarized all the prior studies to date pretty well. When compared to spacing of that ideal 18 to 24 months, if a new pregnancy occurs either within 6 months of birth from a prior child or greater than 5 years after that previous birth, there's a significantly increased risk of lots of things, like preterm birth, the baby being born for small, low birth weights, fetal death, early death of the baby after birth, and preterm rupture of membranes.
Another paper published in JAMA in 2006, also had summarized many of the prior studies that were prior to that date through a meta-analysis that also showed preterm birth occurred 40% more often and low birth weight occurred 60% more often in babies when conception occurred less than 18 months after a previous delivery. So this paper also found increased risks for these outcomes as well when there was more than 5 years between pregnancies. However, all of these risks may not be quite as high for you, making it okay to consider having another pregnancy sooner or later. Or maybe there are special things in your health history that make it important for you to wait that 1.5 years before getting pregnant again.
Now, one of the leading hypotheses about what's to blame for these increased risk of things like preterm birth, stillbirth, and low birth weight in these babies has to do with suspected nutritional depletion or inadequate time for mom to recover from that prior pregnancy.
Makes sense, yeah.
And this short recovery time also appears to carry higher and higher risks as a woman has more and more pregnancies.
Right. For us, we had always imagined having kids close together in age. However, when we started thinking about having baby number 2, we kind of wanted to know how soon is it okay to start trying again?
It's important to realize that the WHO recommendation for waiting that 18 to 24 months between pregnancies is factoring in the risks of short pregnancy intervals in resource-limited countries.
However, if you're in otherwise good health and your body has had a chance to recover from your prior pregnancy, there are newer studies showing that intervals of 12 to 17 months or even 6 to 17 months may have only limited increased risk to you and your future baby.
Yeah. Now, published in 2021, this particular study looked at data from more than 5.5 million births in the US, Australia, Norway, and Finland. And in these relatively resource-rich countries, there's evidence to say that recommendations for those prolonged wait times between pregnancies may have been overstated.
Briefly, what this study found was that in these populations they looked at, birth intervals of less than 6 months were associated with an increased risk of spontaneous preterm birth. But there was very limited evidence of a significant increased risk of preterm birth for the other intervals, 6 to 17 months.
Yeah. Now, interestingly enough, it was seen again that waiting for more than 5 years between pregnancies did carry with it significant increased risks of preterm birth, low birth weight for babies across these populations.
The real key here in when to get pregnant again is to make sure that you are both physically and mentally well and that you are ready to take on the challenges of pregnancy and raising an additional little human.
For many, that right time to start trying again may be 6 to 12 months after that prior pregnancy, or maybe that 12 to 18 months is going to be a little bit more right for you and your family.
Yeah.
Either way, check in with your OBGYN and or primary care provider and get their thoughts on making sure you are medically ready for another pregnancy. There's like so much medical literature, and of course the purpose of this video is to talk about like when is medically the right time, but we cannot overstate that there's so much more to this decision than just like when is the right time for mom and that next baby.
Yes, and I mean, it happened so fast that people are like, when are you having your next baby? I think Cease was 4 months old, and people were like, when's the next one coming? Bowie, like the same. Are you going to have another baby? Is your family complete? And
how do you feel about number 3?
Having been like completely overwhelmed there postpartum with 2 littles, then I would have said, not a chance. That has evolved.
Yeah, as they grow, like we said, like we did the 2 under 2 thing, and it was tough.
Don't recommend.
It was tough, especially that first 6 months.
Yes.
But then they start playing with each other.
It does like get easier in some ways, and everybody
and harder in others. The fighting.
Everybody says, you know, it's all hard, and it's just different hard as they get older. I think that's true, but you know, you consider the medical recommendations, what is going on with you physically, medically, what you want to be your healthiest self going into pregnancy if you can. Obviously, life happens to the effect of, oh, we're pregnant a lot sooner than we thought. And there was kind of also what happened with us where we said, okay,
let's do number 2. We want them really close together. And then
we started, I'd say we started trying when Cease was about 7 months old. And then we just couldn't get pregnant. And we didn't get pregnant, and found out we got to have a little journey with secondary infertility. And so you just never know what life is going to throw at you either. You can plan everything in the world, and sometimes it just doesn't go according to plan.
Yeah, and the other thing to think about is like, do you have space for them? Like we bought
Bo's,
this.
Bo was in a closet for the first year of
We
his
bought
life.
this little 1-bedroom farmhouse that just like didn't have a whole lot of room to grow into yet. And then so like, there's so much of this. What are you gonna do for childcare? Nothing is straightforward, but thinking about all these little details in addition to the medical facts really helps.
And also balancing that with like, hey, life happens, you figure it out, and it's all okay. People do more with less, and there's a lot of joy. So whatever you decide for your family, we wish you
Good luck,
the best.
Godspeed.
And hopefully this helps you try to figure out when to start trying for number 2, 3, 4, whatever that may be for you. And next week, I think we're going to talk about some tips for getting pregnant fast. If that is in the cards for you, keep your eyes out for that video to help you on the way. We absolutely need to mention a couple potential factors that could change the amount of time you should wait between pregnancies. And the first I want to mention is a C-section. There have been many studies to show increased risk to moms with short time periods between pregnancies after C-section. Particularly, it's increased risk of uterine rupture and needing blood transfusion if that interpregnancy interval was less than 6 months. So if you are especially hoping to try for a vaginal birth after a prior C-section, this might be even more reason to try to wait that 18 months before you start to try to conceive another pregnancy. And that is because it is really allowing your uterus time to heal and strengthen in the area of that prior uterine incision that's got to heal.
Yeah. Now, if you've had prior preterm births, this may also be another reason to think about that spacing between pregnancies, because prior preterm births puts you at an increased risk of having another preterm birth and potentially increased morbidity for mom.
Yeah.
Because of this, ACOG recommends that those with prior preterm births should be counseled specifically that short interpregnancy intervals may negatively affect subsequent pregnancy outcomes. And it may potentially be beneficial to target that 8 to 24 month window.
Having said that, if this is you, talk to your OB about your prior preterm birth, and if there are any things or interventions that you could change that could potentially decrease your risk of repeat preterm birth, and as well as their thoughts on what an ideal pregnancy spacing would be for you.
Yeah. That recent meta-analysis we talked about from 2023 suggests that there may actually be an optimal birth spacing after a prior preterm birth. It might actually be as early as 9 months.
Right. Patients ask, what about if you've had a prior miscarriage? Does that affect things? And so if you've had a miscarriage or loss of pregnancy prior to 20 weeks, there have not been increased risks for preterm birth seen with short intervals between pregnancies. So after a miscarriage, when you feel that you are mentally and emotionally ready to try again, there is no reason to wait.
Yeah. Now, if you've had a stillbirth after 20 weeks of pregnancy, you are at a risk of having another stillbirth in future pregnancies. But this does not appear to be affected by that interval between pregnancies.
Correct.
And so that next pregnancy may be best considered after an investigation of what potentially caused that first loss, if that's at all possible. And then addressing what potential modifiable risk factors there are, which could be things like quitting smoking or reducing other risk factors like obesity or diabetes.
Interestingly, one health condition that is actually better with a shorter interpregnancy interval seems to be preeclampsia. Intervals that are longer than that 1 to 2 year mark are actually associated with about a 10% increased risk of preeclampsia per year since your prior pregnancy.
Now, hopefully as we've gone through all the evidence today about what is that optimal timing for thinking about trying to get pregnant again, you really get to see that there is that ideal window from prior recommendations of 18 to 24 months. That is still very reasonable. But for many, it still may be safe and reasonable to think about trying to get pregnant as soon as 6 or 12 months after that prior pregnancy if you don't have any of those other special considerations.
Right. And this is something we also talk a lot about with my IVF patients is when do we do our next embryo transfer? And again, we're balancing, hey, mom's health, baby's health. We want to complete our family, maternal age, so many things. And the recommendation that most of us also follow in the REI world is, hey, we don't really think we should do an embryo transfer before baby's about 1. That 12-month mark seems to be optimizing some of those risks while also balancing efficiency in completing your family. So that's just something we think about there too. Obviously, so many factors, but healthy baby, healthy mom is something that is at the forefront of our mind. So talk to your OB.
And for us, like a lot of it like went into like what is going to be right for our family, timing, finances, being mentally ready for both partners.
And then turned out, despite starting to try, we were not able to get pregnant, went down the whole infertility road. So you can make all the plans in the world and you never know what life will throw at you. So hang in there.
Yeah, hopefully this helps. If you've got questions, comments, add them in the chat below. Make sure you're subscribed.
And we'll see y'all next week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.
Of course, this is a very personal decision and a lot.
Oh, we got the button.
Well, we can fix it.